Did your baby just start on a new formula and you're like, is my baby tolerating the formula or are they not tolerating the formula? It's a very, very common question that lots of parents have. So let's dig into it. Hi, my name is Erin Moore. I'm a pediatric nurse practitioner and a lactation counselor who is here to serve up bite-sized pieces of feeding information so that you can feel good about feeding your baby. Make sure to hit subscribe. Let's start off by talking about ways to know your baby is tolerating a formula well. So whether you're moving from breastfeeding into formula or you're switching from one formula to another formula, we want to make sure that your baby's demeanor doesn't change for the worse, that your baby is still having adequate wet and poopy diapers. Now we know that poop will change a little bit and that's okay, but when the poop is coming out, they should be comfortable and it shouldn't change so drastically to the point where you're like, ooh, I'm concerned about this. And then overall, your baby should be eating similar amounts than they were beforehand and gaining weight appropriately like they would have beforehand. So that is, if they're younger than 3 months, they're gaining somewhere between 0.8 and 1 ounce per day. So we're talking about adequate wet and poopy diapers, so it's showing us that they're hydrated, they're getting enough calories, their digestion doesn't change so much, and overall doing well. That would show me that a baby is tolerating their formula well. On the flip side, let's talk about how to know a baby isn't tolerating their formula. So any indication that baby is not eating enough, so they're not getting their ounces in, they're not finishing their feeds, so they went from eating a certain amount and now that they are not eating that amount, that would be concerning to me. If they're not having adequate wet diapers or they're having changes in stool that are very uncomfortable, and we'll talk a little bit more about digestive changes and expected digestive changes when you start a new formula. Those would be concerning to me. If your baby is having what you would consider projectile vomiting, I'd want you to talk to your pediatric provider and have your baby examined. Or if their stool is looking like bloody or mucousy, those would all be reasons why I think I would consider talking to your pediatric provider and seeing if there's a different formula or a better formula for your baby. So I always say to just trust your intuition. If you are feeling like there's a problem, it never hurts to reach out to your pediatric provider. I want to share a few things that I would not expect to have happen if your baby starts a new formula. So I would not expect them to have any kind of rashes or hives or any other skin changes when starting a new formula. If that is happening, you definitely need to talk to your pediatric provider. If there's any kind of facial swelling, any kind of tongue swelling, any kind of unusual symptoms that are not related to digestion, or anything that would indicate more like anaphylaxis versus just having a little bit of digestive changes, those would be 911 or calling your pediatric urgent line at your clinic. So just know that there shouldn't be any rashes that come about when starting a new formula, even if you're breastfeeding before. If your baby was tolerating you eating dairy, I would not expect that your baby will have any issues with tolerating or at least like having non-allergic reactions to infant formula. Digestion will change after you start on a new formula. So I want to make sure that when digestion changes, it's not to an extreme extent and that your baby is pretty comfortable. So we can expect that when you start on formula, your baby's poop might be a little bit harder and might be a little bit darker. This is due to the iron in formula. Now, I want to make sure that when your baby poops, they can get it out pretty easily so they're not so uncomfortable or in distress when they're pooping. They might have a little bit of gas, but I want to make sure that the gas comes out pretty easily and they're not at a point where you would consider them like extremely gassy or extremely uncomfortable with gas. I want to make sure that poop is not bloody or super liquidy unless they're on a partially hydrolyzed formula, in which case we can expect that poop might get a little bit darker and it might get a little bit more liquidy. So that is not unheard of. But if your baby is on a formula with an intact cow milk protein, it shouldn't get too liquidy. And then I just want to make sure that the baby is not going into anything that you would consider like back arching, projectile vomiting, anything that are more of the extreme digestive symptoms. If you're noticing that stuff, I would call your pediatric provider and have a low threshold for getting advice on what formula to go to next. So digestion might change, but it shouldn't be so bad that you are like, oh my gosh, my baby has changed so much. They should be pretty comfortable or fairly comfortable, and things should start to improve. If you are looking for more information on the right formula for your baby, check out the baby feeding database, which gives you an in-depth description on all of the formulas available in the US. It is never the wrong idea to reach out to your pediatric provider or to reach out to a medical professional like me, where we can do an evaluation and find the right formula for your baby. Make sure to hit subscribe for all of your bite-sized pieces of feeding information. Bye-bye.